English for Nursing. Outline of Research Article. Group 1. Ani Nur Aziza, An-Nafisa Masuro, Dea Oktrianur. Title: Health-related quality of life in locally advanced cervical cancer patients treated with neoadjuvant therapy followed by radical surgery. A single institutional retrospective study from a prospective database. Author: Bolin Liu A, Lingxia Li Bei, Mengxin Wang Bei, Linsun Weishi, Jia Li Bei, Wei Zhou Bi, Yanhong Lev Bi, Hongju Zhang Bi, Sujuan Liu Bi. Next, background. Cervical cancer is the fourth most common cancer and fourth leading cause of cancer death in women worldwide, which account for 5, 6, 9, 8, 4, 7 new cases and 311,365 deaths annually. In China, there are 9,890 newly diagnosed cervical cancer cases and 30,500 associated deaths annually. 2. Moreover, China has shown an increasing trend of morbidity compared to the decreasing trend in transition countries, which might be related to insufficient cervical cancer screening, increased incidence of human papillomavirus or HPV infection, and relative shortage of HPV vaccines in China. Next, methodology. Type of the study in a single cancer retrospective study from a prospective database. 275 VIGO stage IB2 3B patient who underwent CCRT or RT plus RS were included. Here KOL was prospectively assessed by EORTC KLKC 30 and EORTC KLK CX2 for prior to any treatment or baseline, and 6 months after surgery respectively. Time and setting in conducting research. The Department of Obstetrics and Gynecology of Haijin Hospital or Saint People's Republic of China between September 213 and June 218. Population and sample patient admits with cervical cancer at the Department of Obstetrics and Gynecology of Seijing Hospital were included in our study if they were aged greater than 18 years old, had histological proven LACC or FEGO stage AB2 3B were planned to receive neoadjuvant therapy followed by RS, and if they of their legally authorized representative give informed consent. We exclude patients with paratoric lymph node metastatic according to magnetic resonance or MR or computed tomography or CT imaging or pelvic lymph node metastatic sound or MR or CT imaging was not an exclusion criteria. Previous diagnosis of other malignancies or abnormal radiotherapy or surgery, significant psychological or mental illness who were unable to cooperate, and presence of a confounding condition or disease that could potentially impact HRQOL or AG myocardial infarction, severe infection, severe liver and renal malfunction, autoimmune disease. Sampling technique HRQOL was prospectively assessed by EORTC KLKC 30 and EORTC KLKC X2 for prior to any treatment or baseline, and 6 months after surgery. Next procedure. A database was established to prospectively collect associated information and schedule follow-up appointments. Demographic and clinical variables include age, educational level, occupational status, marital status, menopausal status at diagnosis, VIGO stakes, histology substeps, lymph node involvement, limb vascular space invasion, and comorbidities or diabetes, hypertension, hypercholesterolemia, etc. were recorded. Conclusion: improved general QOL and functioning, reduced tumor-related symptoms, but worsened treatment-related symptoms including lipedema and menopausal symptoms were observed 6 months after neoadjuvant therapy with CCRT or RT alone followed by RS in LACC patient. Patients treated with RT plus RS had a generally better HRQOL 6 months post-treatment than those receiving CCRT plus RS in terms of greater improvement in functioning and less toxicity. The findings of the current study may serve as a reference to evaluate the efficacy and safety of new treatment strategies including neoadjuvant chemotherapy and/or radiation in terms of secondary outcomes as well as a stepping stone to promote further research into the evaluation and intervention of patient perfection (HRQOL).